wonder what to expect during your exam and cleaning session? I'm Dr. Nagme Mel Mortazai, and I'm here to explain. To summarize, the appointment consists of 16 steps and usually takes something between 1 to 1.5. I'll explain each step one by one, as I've been asked many times throughout my career about the reason behind each step, of course. Why is it important to let your dentist know about your concern and dental problems at the beginning of your appointment? The simple answer is, if you don't tell us, we won't know. So for example, sensitivity, grinding, a history of trauma or accident, dental phobia, cosmetic concerns, or concerns about the shade or shape of your teeth, wanting aligned teeth, pain. These concerns are the one that we cannot know unless you tell us. And letting us know about these concerns help us or your dentist investigate in more precise way to solve your problem. Remember, you are the only one who knows what's bothering you. Your medical history. What does the name of my medication have to do with you as a dentist? Why do you ask me about my medication or my medical history? You won't believe how many times people have asked me this. And here is the answer. Some medication could interfere with our dental treatment. I'll give you some examples. If you're taking blood thinners like aspirin or warfarin, and you need, for example, wisdom tooth removal, you may bleed a lot after the extraction. So we need to plan and be ready for it. Or if you take medication for osteoporosis, which is basically a bone density disease, your wound inside the mouth may not heal. Another example is that if you are on antidepressants, you may have less saliva and be more prone to getting cavities. These are good reasons to let us know what you're taking. And remember, you took a note and you never ever share your information with anyone. So everything is going to be confidential unless you give us the consent to share the name of your medication with someone else. What is the importance of your dental history? Why is your dentist digging into your past dental issues? And why you need to let her know or him know about your dental problem, like previous ones, of course. The answer is simple, and I'll give you some example as well. If, let's say, you had a traumatic experience years ago, you would most likely have at least some sort of minor dental phobia. Another example is that if you had trauma on one of your front teeth years ago, your teeth may need further review and assessment, and your dentist need to check to see whether your front teeth are still alive. So please don't hesitate to let your dentist know about your previous dental issues. Why do we ask you about your habits, like smoking? I was sitting next to two lovely young men in a waiting area of a public hospital once, and I overheard that one of them was saying that his dentist had asked him whether he was a smoker or whether he used any drugs, and also asked him about his brushing habits. How rude! The reality is that we ask your habits like smoking, drinking, and brushing to assess the risk of, for example, oral cancer or developing cavities. Sometimes we ask you what you smoke, and we don't mean cigarettes. Be sure that there will be no judgment whatsoever. We've seen everything and we heard everything. Trust me on this. The next part of this session is extraoral exam, meaning that we exam outside your mouth, and the TM joint assessment as well. So how we assess your TM joint, how we know whether your joint is healthy or not. So what we do, we touch directly over the joint while you open and close your mouth, and we check how much you open your mouth and see if there is any restriction or deviation or opening and closing, and that's how we assess your joint. And also, Sometimes your dentist touches your neck and under your jaw to check your lymph nodes. So basically, we check your lymph nodes for any tenderness or enlargement, which could be an indication of infection or even cancer, for which more investigation might be needed. So if your dentist touches your neck, or just don't be concerned. So that's a normal procedure to examine like outside your mouth. Oral cancer screening. Did you know that more than 54,000 Americans get oral cancer each year? And about 11,000 people out of those 54,000 lose their lives to this disease each year? That's like one person per hour, 24 hours a day. And you see how serious it is? So that's why you need oral cancer screening. What you need to look for when it comes to the sign of oral cancer. The first thing is sores around your lips or inside your mouth that won't heal. So if you have like these symptoms, you need to go and see your dentist. Pain when you're swallowing. Like if it lasts more than 2 weeks, you need to go and see either your dentist or at least your doctor. White or red patches inside your mouth. So these are serious signs that need to get checked when it comes to oral cancer. Lumps inside your mouth. So if there's a lump and it lasts more than 2-3 weeks, go and see your dentist. Those are the signs that you need to look for when it comes to oral cancer. So the importance of getting regular cancer screening is undeniable. Your dentist checks your lips, your tongue, your gum, your cheek, your tonsils, the roof and the floor of your mouth for any lumps, white or red spots or sores, and make sure that there is no oral cancer inside. Early detection of oral cancer is the key to preventing it from spreading to the rest of your body and also beating it. So make sure that whenever you go and see your dentist for your exam and checkup, ask for oral cancer screening if your dentist doesn't do it. Dental charting. What is it? You may wonder about the meaning of what you hear during your exam session. Things like 1-8 distal caries or 4-4. This is how we chart your teeth. We are basically recording the number of your teeth and what has previously been done on each tooth. In addition, we check your teeth surfaces that can be checked and recorded for by us without x-ray. For example, if there are any cracks or cavity on them, we just mention it to our nurse and our nurse gonna add it to your chart, dental chart. Gum disease check. This is called a dental probe. As you can see, the tip of this is totally blunt. So I'm trying to use it on my gloves, and my glove is very thin. But this thing cannot even tear my gloves. What it means that it basically won't cut or won't cause any injuries to your gums. Basically, this tool is like a ruler. We measure the depth of the gum around your teeth with this tool or with this instrument. Healthy gums should fit snugly around each tooth, and the depth of our measurements should only be something around between 1 to 3 millimeters. If our measurement shows more than 3 millimeters, it means that the spaces around the teeth have become infected and now we have pockets. This kind of gum disease and infection could lead to bone loss and eventually lose teeth if left untreated. Also, healthy gums must not bleed after or during our probing with this instrument. So trust me when I say that using this instrument won't cause your gum to bleed. Bleeding is another indication of gum disease. And no, our tool is not the reason for your gum bleeding. So now you know what those numbers means when your dentist is probing your gums. If your dentist says that your gum bleeds a lot, it is because you already have gum disease, and this tool or this instrument is not the reason. And also, when you hear the numbers like 1, 3, 5, 7, 1, we are measuring the depth of your gum. And if the number is more than 3 millimeters, this is not a good sign, and it's telling us that you have pocket. Another step of exam and cleaning session is taking photos. So this is called intraoral camera. As you can see, the head of the camera is very small. So this small camera easily goes inside your mouth, and we can take photos of each and every one of your teeth. So not X-ray, photos. I myself cannot see what's happening inside my mouth, even when I try to using a hand mirror to see inside like my mouth. However, with this small camera, it's like we are having a tour inside your mouth, and it shows us everything, and we record everything, and then we show all of those reports to you as well. Dental radiographs or X-ray. And why does my dentist have to take X-rays? Unfortunately, there are some areas on your mouth that your dentist cannot see without radiograph. For example, your teeth contacts area. This is the most susceptible side for cavities because food gets stuck there. The only way to see if there is a cavity in this area is by taking X-rays. There are other reasons for taking radiographs as well, like checking and seeing if there is an infection beneath the root of a tooth, detecting gum disease, like for example, if there is any bone loss, or even cancer detection. So X-ray is not only for like seeing if there is any cavity or if everything is okay with your teeth. The next step of this session is cleaning. There are two types of cleaning: routine cleaning and deep cleaning. While most people believe those two cleaning are the same, there are a number of significant differences between the two treatments. Regular dental cleaning is recommended typically every 6 months for individuals with good oral health as a part of preventive dental care routine. So that's very important that you know that it's for people with no gum disease. So the last step of our exam and clean session is when the cleaning is fully done, the fluoride is applied, and I ask my patient to come and sit with me, and we look at the photos and X-ray together, and we discuss about our findings, and then we discuss about our treatment options, or usually more than one option. And then when we agree on one option, we proceed with the treatment. So those are all the steps about our exam and clean session. If you have any questions, please just write a comment on the comment section, and I try my best to answer all of your questions. And that's it. Till our next video, keep smiling